Hello, everybody. My name is Margherita Fabri, and I am a neurologist, expert in movement disorder, working at the University Parkinson Disease Center of Toulouse in France, even if I'm Italian. So I'm an expert in movement disorder and on Parkinson disease and the typical form of Parkinsonism. And here in Toulouse, our main area of research interest are clinical trials for people with Parkinson's disease, and we perform any kind of treatment management, including oral treatment and device-guided therapies. I'm here to speak to you about motor symptoms in Parkinson's disease and what I can tell to you about motor symptoms. We can say that Parkinson's disease motor symptoms are characterized by the presence of resting tremor in about 70% of people with Parkinson's disease. What is resting tremor? Is the presence of shaking of oscillatory involuntary movement, which is a shaking which can be present in both upper limbs, sometimes lower limbs. It is usually asymmetric and it can interest also the chin, and it can be visible when you are at rest or also during walking. Along with resting tremor, other motor symptoms include slowness of movement interesting fine motor task or writing, or slowness of gait, which is usually quite mild and not bothersome at the disease starting. Other motor symptoms include rigidity, which can be related also to pain. The diagnosis is usually based on those motor symptoms, and indeed all people with Parkinson's disease present those motor symptoms, which are, as I said, a key point for diagnosis. I do to you an example. I usually see about 20 people with Parkinson's disease per week, and all of them present motor symptoms. And just to make to you another example, I see patients from the age of about 20 years up to the age of 90 years, so a very large and wide range of age, as 10% of people with Parkinson's disease has less than 40 years when we do perform the diagnosis. Motor symptoms are the most visible ones, even if other non-motor symptoms may be present even before the appearance of the motor ones. The severity and combination of motor symptoms of Parkinson's disease are usually very variable over the disease, with an aggravation of some feature and the appearance of other ones, and usually the appearance of axial motor symptoms, which include the symptoms that are on the axis of a person. So they include imbalance, which eventually may lead to falls, impairment of gait, or freezing of gait, which is defined as brief episodic absence or marked reduction of forward progression during gait of the feet, despite the intention to walk. But I have a good news to you. Motor symptoms have an excellent response to the dopaminergic treatment in Parkinson's disease, above all in the early stage of the disease. But this response is still present or preserved in more advanced stages, even if fluctuation in motor symptoms over the day may make more challenge the treatment management of those patients who may require a combination of different tablets, and eventually in a part of them, the start of a device-guided treatment.